Hi guys, my name is Hendy, and I am in the Family Nurse Practitioner track at EKU. I did my project on family involvement and how that improves weight loss of obese pediatric patients. The prevalence of obesity, specifically in the pediatric population, is a major health problem in the United States. Obesity affects around 12.7 million children and adolescents across the nation, which is about 1 in 5. Less than 30% of high school students get 60 minutes of physical activity every day. These adolescents will develop a greater risk for early death, heart disease, stroke, type 2 diabetes, depression, some cancers, and other health risks. In Kentucky, obesity is ranked 5th in the nation. This is a significant health problem that can potentially lead to other health risks later in life. As family nurse practitioners, we will be seeing many of these obese adolescents as well as adults in the clinic setting. This is a perfect opportunity to educate these patients on the importance of maintaining a healthy weight and exercise plan. Throughout my research, I came across 4 studies that I'm going to discuss with you. The first study included obese adolescents who were recruited through a Y Health coaching program. Exercise classes were offered twice weekly and nutrition classes were offered once a month. Parents had to agree to attend each class with the child every time the child attended. They were randomly selected to be placed into an experimental and control group. The experimental group, parents were provided weekly newsletters and text messages for 5 weeks, and the control group had no intervention. They just were offered the classes along with the experimental group. The results showed that BMI slightly decreased with the experimental group. Study 2 was a chart review of 3 obese adolescents that visited a specific clinic within a 5-year period. The multidisciplinary approach was used as well as temporary living arrangements. During this time, the two adolescents went and lived with family members who had an increase in family support for like healthy eating and weight loss. And while one of the adolescents went and lived with a family member who had a decrease in support or about the same support. So the two that had a positive family influence had an actual decrease in BMI, while the one who had little to no family support actually gained weight. Study 3 used a family-based MEND program. MEND stands for Mind, Exercise, Nutrition, and Do It. This is a family-based education program that offers skills training, motivational enhancement, and education. Exercise and education was provided to both groups. The treatment group involved the family-based MEND program, and the control group was only provided the exercise and education classes. Height and weight was recorded at each visit to determine BMI, which was tracked throughout the program. And the results showed that there was a decrease in BMI for those that were involved in the family-based MEND program, while there was a less decrease in BMI of those that did not have the family-based MEND program. Study 4 included obese adolescents who were randomly assigned to a treatment group and a control group. The treatment group provided education to adolescents and their parents, while the control group had no family involvement during the 10-week study, and education was just provided to the adolescents. A self-report of physical activity was collected at baseline and at the conclusion of the intervention. Participants in the treatment group supported a higher level of physical activity than those in the control group. So for intervention and methods, the purpose of the study is to determine the effect that family involvement has on weight loss, healthy eating, and exercise in obese pediatric patients. Selection criteria includes ages 5 to 18 years old, BMI of greater than 30. The project location is at the University of Kentucky General Pediatrics at Kentucky Clinic South. The plan is to have the same parent attend each bi-monthly clinic visit for education on healthy eating and exercise plans for a 12-month period and to collect measurements for BMI. BMI will be recorded at the first clinic visit, tracked bi-monthly over the 1-year period, and then again taken at the end of the 12-month period. The parent and/or family member will agree to receive weekly text messages, emails, and/or newsletters reminders to further educate and encourage healthy lifestyle choices. Data will be stored on the electronic medical records system and collected at the end of the 12-month period. BMI will be input onto a chart and analyzed from baseline to the final measurements at the end of the study. Evaluation will look at the chart and how the BMI either increased or decreased throughout the 12-month study. Outcomes will be measured by determining the change of BMI at the first clinic visit, every 2 months at the bi-monthly clinic visits, and then at the end of the 12-month study. The proposed outcome is a decrease in BMI from the first to the last measurement. The goal of the study results is to increase family involvement in dietary weight loss plans and encourage adolescents to be compliant with a healthy lifestyle. Another goal is to aid as a reference for future studies to build evidence of the importance of family involvement in weight loss. In conclusion, the National Institute of Nursing Research states that the best way to overcome the symptoms of an illness is to prevent the illness and disease from occurring in the first place. As family nurse practitioners, it is important to remember that educating in a primary setting can go a long way, and consistently encouraging family involvement can increase the compliance of pediatric lifestyle change and decrease obesity overall in the United States. Thank you.